It looks like we're set for both.
Right.
Mhm.
So I'm calling meeting to order 7:30.
Adequate notice of this meeting pursuant to the Open Public Meetings Act was posted on the bulletin board at the City Hall, on the city's webpage, distributed to the record and filed in the office of the city clerk. Pledge of allegiance. I pledge allegiance to the flag of the United States of America, and to the republic for which it stands, one nation under God,
God, indivisible,
liberty.
justice for all.
Moving on to item 2, items for approval. We'll bundle items 2A.
Mr. Wilson, I'm sorry, just a roll call.
Oh, I'm sorry.
Ms. Davis,
Yes, I'm present, sorry.
Dr. Sadler. Dr. Sofer. Present. Mr. Tender,
Here.
Dr. Solomon,
Here.
and then, okay.
Moving on to item 2, items for approval, which is the board's consent agenda. We will bundle items 2A through 2D for approval, which includes the minutes of the November 12th, 2025 meeting, revenues of $7,263 for November 2025, expenditures of $3,604.31 for November 2025, and employee reports for November 2025. Board will need a motion to approve in a second.
Second. Ms. Davis,
Yes.
Dr. Sadler,
Yes.
Dr. Sofer,
Yes.
Mr. Tender,
Yes.
Dr. Solomon,
Yes.
Continuing to item 2E, retail licenses for November 2025. Is there anything about these licenses the board should be made aware of?
No, they're all in compliance.
Moving on to resolutions.
Need a vote.
Motion, so moved.
Ms. Davis,
Yes.
Dr. Sadler,
Yes.
Dr. Sofer,
Yes.
Mr. Tender,
Yes.
Dr. Solomon,
Yes.
Moving on to the resolution section of the agenda. I'll read each resolution into the record, and for each, the board will require a motion and a second before a roll call. Resolution R2510 reads, be it resolved that the Board of Health of the City of Englewood hereby ratifies and approves the following schedule of regular meetings for the year 2026 at the Englewood Department of Health, 73 South Van Brunt Street, Englewood, New Jersey, or via YouTube live stream at 7:30 p.m. All meetings on Wednesday unless otherwise noted. Those dates being January 14, February 11, March 11, April 8, May 13, June 10, July 8, September 9, October 14, November 18, and December 16. The board will require a motion and a second.
Second.
Sorry, I just wanted to go over the dates. I didn't have a chance to do it. So April 8th is Passover. So I don't know if you guys want to move it.
Is it on the first days or is it the intermediate days?
It's the 7th day.
And I'll be out of the country. I assume it's 4
Yeah,
plus.
I will be away. Also, it's a holiday, so I suggest that we push that one to another date.
Suggested alternate date.
The alternate date I would say would likely be I guess it would be April 15th. Is that like tax day?
Okay.
But
with
yeah,
that.
it'd be like one week later, unless you want, yeah, I think it has to be the following week. That's what I would suggest. And then let me just look at September. September 9th is fine.
What about the October date? That's okay?
Yeah,
The
that's what I'm
September-
looking at it right now. The October date looks like it's fine. It was just that one date. I think that was the conflict. I don't see any other glaring conflicts.
Is everyone okay?
Could
with
we, yeah, so I was gonna make a motion to approve the resolution modifying April 15th with to April 8th to April 15th.
I think I might have always, everybody else is okay with that date?
We still a roll call.
Oh, Ms. Davis,
Yes.
um, Dr. Sadler,
Yes.
Dr. Sofer,
Yes.
Mr. Tenzer,
Yes.
Dr. Solomon,
Yes,
Moving on to resolution R 2511 reads as follows: be it resolved by the Board of Health of the City of Englewood that Catherine Surya Sava is hereby appointed to the position of part-time executive secretary / sub-registrar for the Department of Health of the City of Englewood effective December 15, 2025, at a salary of $25 per hour for 20 hours per week. Require a motion and a second.
So. Second.
Ms. Davis,
Yes.
Dr. Sadler,
Yes.
Dr. Sofer,
Yes.
Mr. Tenzer,
I'm gonna abstain.
Dr. Solomon,
yes,
Moving on to item number 5, board liaison reports. Are there any reports tonight from the liaison to the council?
I did go on the 25th of November, and I got through the part where they pretty much gave awards to the coaches, to the city sports teams, had a little reception for them. Came back, the planning commission talked about the restrictions. It was actually the, let me just check my notes so I can actually make some sense here. They were, the planning board reported on the requirements identifying various entities like houses of worship and hospital zones and that, and talked about facilities like medical facilities that are getting Botox and those kind of things. If they're downtown, they really should be presented as retail, more retail than medical facilities. So they talked about that. Nothing else really health related. And then I guess about 9:30, one of the council members had to leave for an emergency and the other council member wasn't able to continue Zoom participation. So there was no quorum and the meeting ended. So it was pretty short. So not a full report, but that's what it was.
Moving on to item 6, committee reports. Are there any reports from any committees this evening? Not hearing anything. Moving on to
all right,
item,
did we talk about the budget meeting? Didn't we do the budget meeting? Is that for this meeting? My
Prior to.
time is lost. Oh, it was before this? Okay.
Last meeting we had here was before you guys met, I think.
Oh, so we have met since.
No, this is our first meeting. We're
Okay, fine. Okay, so then we do have a report from the budget meeting.
Yes.
We went over the budget. There were no glaring changes. There substantial information was discussed about budgeting for the anticipated increases in the salaries with some shifts. And then the potential discussion about a health officer and with a separate position for a director if needed, if hiring process does not go as planned, which I think we can discuss when we discuss personnel, right? I don't think there was anything else major, right, Deborah?
No, that's it. Yep.
Now moving on to item number 7, old business, communicable disease update. Ms. Baldwin.
I'm just gonna touch on the highlights that Deepika put in her report. COVID-19 for Englewood as of the first week of December. There was a total number of cases of 10,291. This is since the beginning of the pandemic. Confirmed cases and 113 COVID-related deaths. And the trend now is emergency department visits are low for COVID-19, influenza, RSV. However, there continues to be increases in admissions associated with COVID-19 and influenza. So they're just getting directly admitted. I'm not sure how that works. Maybe they go to their doctor's office first and then they get sent to the hospital. There's a new H3N2 flu strain. I'm sure most of you are aware of this by now. That has impacted the effect of the flu vaccine, the effectiveness. The main flu virus circulating in the US is influenza A, which is the H3N2. A new form known as subclade K has drawn attention because of several mutations. These changes may make the strain more severe than usual, and some are concerned that they could reduce how well the current flu vaccine prevents infection. It is also expected to provide cross protection against new variants like this because the antibodies produced to one flu strain can still recognize and respond to similar strains. So there's still protection even if it's not, right on the money. As far as other communicable diseases, the chart that she provided shows that all cases for 2025 are lower than prior years other than 2024. For some reason, 2024 was extremely low. And she has a report on vector-borne diseases. Stats for New Jersey, Bergen County, and Englewood are included. And it's probably, not anything unusual in those numbers. And I think that's all I have for that. Yes.
Moving on to new business item number 8, public health events and outreach. Ms. Baldwin.
I don't have any flyers for events coming up. We do have a blood drive coming up in January. And there is a flyer in your packet. Ms. Rodriguez won the Mayor's Wellness Campaign Award for Champion of Health for 2025. And everyone was very happy and excited about that. I'm not sure how many towns had people apply for it, but you can see on the insert in your packet, they had all the honorable mentions. I think there was 10 if I'm not mistaken. So this is, quite a feather in our cap, I think.
Which then leads us to item number 9, resignations. Ms. Baldwin.
Yes, and so after she won the award, she has given her resignation. She has a job offer from Hackensack Hospital. She says that they came to her, they found out probably from some events that we have done, they picked up on her. And so she will be moving on there the first of the year. I was going to originally discuss some of this in closed session, but I don't think it's necessary. She has offered to to continue working with us on a consultant basis. She put in her write-up to me, basically,
Deborah?
yes, I'm sorry.
I had a phone call with Mr. Hoffman today, so maybe we should do this in closed.
Okay,
I have some additional information.
okay, all right, not a problem.
Moving on to item number 10, REHS Education Bonus Award, Ms. Baldwin.
Aisha Osman has completed her master's degree. And according to the contract, she would be eligible for the bonus award of $1,500 for that with your approval. So I guess we need a vote for that.
I'll make the motion.
Ms. Davis,
Yes.
Dr. Sather,
Yes.
Dr. Silfer,
Yes.
Mr. Tenzer,
Yes.
Dr. Solomon,
Yes.
Moving on to item number 11, is there any other business to discuss tonight?
I have nothing else at this time.
Deborah, I just had a question. I just wanted to ask something in your report. I know we talked about it in the agenda meeting. We are gonna get the social worker, right? That's gonna be obtained through the grant. We okay with that?
Yes, we did have a communication today. We wanted to try to increase that, the agreement period to a year to use additional grant funds. We did get an email back today that we cannot do that. We can only do the 6 months because the grant ends in March. We were hoping that we could have the whole amount invoiced to us in advance, but we were told that wouldn't work. So yes, we are moving forward with the 6-month agreement with them for now.
Good. Thank you.
Moving on to public comment. Board will require a motion to open the floor to public comment, a second and a vote. Speakers will have 5 minutes and must state their name and address.
Second.
Ms. Davis,
Yes.
Dr. Sather,
Yes.
Dr. Silfer,
Yes.
Mr. Tenzer,
Yes.
Dr. Solomon,
Yes.
Hi, good evening, everybody, and thank you for having me and letting me speak. My name is Stephen Weinberg. I live at 558 Broad Avenue, Englewood, of course. I had 3 questions, if you will, 2 of which were as a result of some of the reports. I'd be curious about the details of the blood drive. I should make a comment that some of our distinguished council people, like Dr. Lisa, put out a newsletter, and I didn't see anything about that. So it would be interesting that we coordinate perhaps very interesting things like blood drives, since they are very pro-community things to do. So I'd be interested about some of the details of that, dates and locations and things like that, where and how posted, so I can be made aware of that and share that with my neighbors as well. 2, I just now for the first time heard the dates of the meetings that you guys are scheduled for 2026. And this has come up in front of the board, not the board, the city council. And I'm just curious whether you guys in any way, shape or form coordinate your calendar with any of the other board or council calendars because as a member of the public, I like to attend these meetings. And it is physically impossible to attend simultaneously scheduled meetings, and this has come up several times in 2025. So I was just curious if and how you coordinate that with the other groups. And I would highly recommend that somehow that happened, because even though I could see a recording of an already held meeting, it would be impossible to comment. So I would like that opportunity, and I also like to attend, see what's going on. So that's that. And then lastly, and this came up at the Environmental Commission meeting, and I can't give you a lot of detail about it, but one of the topics that was brought up was IPM, or Integrated Pest Management. And one of the questions that committee had was regarding the specifics of the types of pesticides used. So I was curious whether there was any coordination with this board about the use of those chemicals, especially in and around schools where young children might be exposed. And that's it. So thank you.
Are you aware of any meeting that conflicts with this one, particularly second Wednesday, 7:30?
All I know is that in the past, I attended a meeting here and had to race from a 7:30 meeting to an 8 o'clock meeting just down the, just at the municipal court. That was the one that impacted me, that affected you. And even if you guys wanted to attend, it would have been difficult to do that. And so, and you went to the last meeting, the one that I was there also, the one that got canceled. So I just wanted to make sure that we're trying to avoid that inconvenience. That's all. And no, since I didn't have access to dates for 2026, I can't comment at all about that.
Oh, yeah, I was just wondering if there's a standing meeting. I know the city council meeting usually on Tuesday, this is on Wednesday, there've been some ad hoc town hall kinds of things,
Yeah, and then we're talking about, like, on one particular day, and this was back in November, there was simultaneously Board of Health, Recreation, and the Environmental Commission meeting,
Okay.
all on the same night. So you catch the drift. I like to attend those.
Got it. And Deborah, just to the question of the pesticides, where would that be directed? I know we have an environmental group here, but where would that information be if,
The only
I
pesticide,
don't know, actually.
the only thing I'm aware of that we use is the bait blocks for rodents. And they are put, they are put in inconspicuous places. They're not put by kids. That I know.
I think the topic is the product Roundup was mentioned. So
Okay.
No, it's not. That's something called Contact.
Okay.
CATAC. I just saw it the other day, actually. And as far as the blood drive, it's already been posted on the electronic bulletin boards. I'm not sure if it's on our social media yet. I'd have to check that, but it is on the boards.
Thank you.
Is there any other public comment tonight? If there's no further public discussion, the board will need a motion and a second to close the floor to public comment.
Ms. Davis?
Yes.
Oh. Ms. Bostic?
Yes, I'm here. I don't
I
have any
know.
comment.
Just
Hello.
because I saw you, sorry, that's it. Dr.
Okay.
Sadler?
Yes.
Dr. Sofer?
Yes.
Mr. Tender?
Yes.
Dr. Sullivan?
Yes.
That is my cue to leave. So
Good luck.
you guys have a
Have a good
great one.
evening.
Enjoy the rest.
Just stop you to.
The Open Public Meetings Act of the State of New Jersey permits the exclusion of the public from the discussion of employment matters. And going into closed session requires a motion and a second.
So,
Second.
Ms. Bostick,
Yes.
Ms. Davis,
Yes.
Dr. Sadler,
Yes.
Dr. Sofer,
Yes.
Mr. Tenzer,
Yep.
Dr. Sullivan,